You are having a normal shift, nothing unusual. Then someone walks in, comes straight to the counter, and says, I don't need advice. Diclofenac 75 worked last time, so just give me that. And before he even finished the sentence, you already know this one's going to take a while. You stay polite, you let him talk, but within 30 seconds, something feels off. Part of what he is saying don't quite add up. The conclusion doesn't really fit, but the confidence absolutely rock solid. And suddenly you are not just helping anymore. You are in quiet back and forth that nobody invited you to. Hello, my fellow pharmacists. I am Ammar Amiri and this is Pharma-Coach. Welcome back to our Counseling in the Pharmacy series. If you haven't seen the previous episodes, we covered greeting, the angry customer, the hesitant one. You will find all the links in the description below. Today, we are talking about the customer type that doesn't get nearly enough attention. Not because they are rare, they are everywhere, but because on the surface, they don't look like a problem. They walk in confident, they know what they want. They have already decided. And that, as you will see, is exactly where things get complicated. Here's what makes this customer particularly tricky. They don't look difficult at first. In fact, they often look easier than average. They come in knowing what they want. No hesitating, no confusion. You think, 1 minute, done. But then the conversation starts. You suggest something. They question it. You try to explain. They cut you off. And slowly, without anyone planning it, the interaction turns into this low-grade tension where it's no longer about helping, it's about who is right. And once that happens, you have already lost the thread. Because the real issue isn't that they know too much. It's that they are very, very, very sure about something that isn't always correct. Most of the time, their information comes from somewhere that sounds convincing on the surface. Something they read online at midnight, an advertisement, a recommendation from neighbor who had exactly the same thing. And once they have accepted that idea, it sticks. They are not coming in to explore options. They are coming in to confirm what they are already decided. Which means if you try to correct them directly, even if you are completely right, it usually backfires badly. The more you explain, the more they feel they need to defend their position. What started as health conversation turns into something that feels oddly personal.
Good morning. How can I assist you today?
I don't really need any advice today. Diclofenac 75 worked perfectly for me last time, so I'd like the same thing again. I already know that's what I need.
Certainly, let me check that for you.
Of course, before we decide that, may I ask what you're taking it for today? Is it the same situation as last time or something different? It's basically the same thing. I've had this before, and I've already looked it up online. Honestly, I'm pretty sure I know exactly what works for me. One quick question, though. Are you currently taking any blood thinners or medications like Eliquis, Xarelto?
Actually, yes, I do take Eliquis every day. I didn't think that was important because I've been taking it for quite a while now. I understand.
Diclofenac can increase bleeding risk when combined with Eliquis, so let's look at a safer option for you.
Thank you so much.
Absolutely.
This is what the conversation should look like. He came in convinced. He had the name in his head. He had confidence and he had no real intention of being questioned. But notice what didn't happen. There was no lecture, no correction, no moment that he felt challenged. One question was enough. And suddenly he was thinking instead of defending. That's the whole point. You are not trying to override their decision. You are trying to make sure their decision actually works for them. And the most of the time, they appreciate that more than they expect to. The mistake almost everyone makes here, and I have made it myself, is trying to win the argument. It feels completely natural, especially when someone is confidently wrong about something clinical. Your instinct is to explain, to clarify, to set the record straight. But the moment a customer feels corrected, they shut down. It stops being about the product, it becomes about the bride. And once the bride is involved, even the most logical explanation in the world won't land. I had a patient once who was absolutely convinced a specific medication was right for him, the same one he has used before. I tried explaining why it might not fit this time. He interrupted me twice, so I stopped explaining. Instead, I asked him, I'm sure you remember what specific symptom did it help you with last time? He paused. Then he said he wasn't really sure. That pause, that 3-second silence, was worth more than everything I have said before it. Not because I explained anything better, but because he started questioning his own assumption on his own, without me pushing him there. What works is simpler than what you think, but also less obvious than it looks. You don't confront directly, you don't rush to correct, you give a little space, you acknowledge what they are saying, and then gently bring the focus back to their actual situation. Sometimes it's as simple as, I can see why you would think that and that. That sentence alone can lower the tension in the room. And when the tension drops, people start listening differently. They are no longer defending a position, they are actually thinking. You are not trying to prove them wrong, you are helping them notice the gap themselves. And that's a very different dynamic. If this conversation goes wrong, the damage doesn't end there. If they leave with something that doesn't work, and it often won't if it was the wrong product to begin with, they don't think their decision was incorrect. They will think you didn't guide them properly. That's how trust erodes, slowly, quietly, without anyone realizing it, until the customer simply stop coming back. And honestly, that's the part that bothered me most. Not the argument at the counter, the patient who left with the wrong product and never told you. At the end of the day, these customers aren't difficult because they know too much. They are difficult because they are very sure. And certainty doesn't disappear when you push against it. It digs in. It doubles down. It brings in the neighbor's opinion as backup evidence. But if you handle it carefully, without pressure, without lecture, without making it like a competition, certainty starts to soften on its own. And once that happens, even a quiet question can open a door that the whole explanation couldn't. That's the job. Not just knowing the right answer, knowing how to make the other person ready to hear it.
If it could help another pharmacist out there, then like, comment, and share.